So I'm Dr. Vikas Jain. I'm a consultant neuropsychiatrist practicing at Delhi for past 25 years. I'm running a center with the name of Perfect Mind, and we have been dealing with all kind of psychiatric and behavioral issues. So I did my graduation and post-graduation from an institute called King George's Medical College, Lucknow, and then I started my practice somewhere in 98, 99. And since then, we have been running three centers at Delhi, two at Padel Nagar, which is central Delhi, and one in West Delhi. We have a team of nine psychologists, an occupational therapist, and a special educator, an hypnotherapist, and the supporting staff. We have been dealing with all kinds of testings, the therapies, the marital therapies, cognitive behavior therapies, and dialectical behavior therapies, and so many other therapies which we have been dealing. We've been dealing with the child population, the adolescents, the adult, the geriatric population. So all kind of psychiatric issues which we are dealing in the society as the coming times. So today I have been asked to present something about COVID and depression, which is the need of the time, as we know that for past 1 year there has been so much of upheaval, so much of turnaround in our lives that we are going to. This has become a really, really hot and demand of the time that we talk of depression during the COVID times. As you know that everything in our life has changed since the pandemic was announced. So I am presenting something about COVID and depression, how COVID is leading to depression. Because I believe that this is the time, after the COVID pandemic is over, whenever it will be over, the second pandemic which we are going to face is of the mental health pandemic. There are going to be a lot of suicides, depression cases, because of so many factors which I am just going to highlight. So the COVID-19 pandemic, which was declared on March 11, 2020, constitute extraordinary health, social and economic global challenges, and it has caused significant distress around the globe. Apart from the evident physical symptoms in infected cases, which we know, it has caused serious damage to public mental health. People facing a pandemic with no vaccination would result in making them anxious, stressed, and depressed. Keeping in mind the concerns regarding psychological distress which rose around the globe and has argued for timely action on mental health during the COVID-19 pandemic. During the pandemic, along the people is the heightened fear related to the coronavirus, culminating in committing suicides and causing severe psychological distress in the form of anxiety, stress, and depression. Similarly, another research which found that psychological distress related to these things are quite common and which is hence alarming now. And it is going on, and it's rising with day. As we know that then the cases are rising again, so these fears are increasing in people all over the world. There are many countries where the lockdown has not still been opened, their economy is not back on the track yet. As human is a social animal, and we have a tendency that facilitates social interaction. And thus, when the movements were curtailed during pandemic, which resulted into psychological distress, the issue of mental health should be considered and also addressed as anxiety, stress, depression, fear, trauma, helplessness, and other psychological issues are experienced during a pandemic. The COVID-19 lockdown affects people differently related to their personalities, related to their learnings in their life, in regard to their sex, profession, socioeconomic status, where they are residing, etc. A person who is with his family with all the necessities may not be as depressed as someone who does not have the same. So that shows that lack of social support system results into more distressors. Furthermore, frontline workers such as healthcare workers, the sanitary workers, the police professionals would be more distressed than some other professional workers because these people, they were always, because the call of the duty, were asked to be there all the time to help with the people who are suffering, to make sure that people getting attention, to make sure that people are given the medical aid at the right time. So these people are more distressed than some other professional workers, and that is the reason that these people were chosen as to be vaccinated on priority basis by the government of India. Essentially, the impact of lockdown will also be influenced by the resources people have, as witnessed in the migration of people. Like there were many people who were factory workers or the construction workers who did not migrate because their owners were ready to pay them for throughout the lockdown. But the people who had to migrate for the worry of bread and butter, they really suffered quite a lot, and there were a lot of news about it all over the world. The plight of migrants was disturbing and has attracted the attention of the world. People emptying supermarkets and panic buying in a hope that they might run out of stock. So they wanted to stock the essentials every day, the groceries and the everything, the medication. So this was indicative of how anxious people were at the time of pandemic. Students all over the world, which is a very important group of our society, they got very, very insecure. They were experiencing distress because of the uncertainty of examinations, the courses getting completed, their exam dates not being announced. They had to be online all the time, and the exams were, postponed. So, with regard to the availability of jobs, that was another issue because there were many people all over the world who got unemployed because of pandemic. Their salaries were cut down. They were asked to join later, and because they were not able to perform from working at home, so they were asked to resign also. There's been a lot of unemployment all over the world, especially in US and India. The anxiety issues among students during COVID-19 were related to their poor economic conditions. The people who were not able to sustain, they had to leave their PGs where they were living. They were not able to get the money for their food because they were not attending the colleges, so they had to go back. So daily life events and everything which hampered the daily activities and academic activities at the most. People who did not have or were vulnerable to get enough supply of daily essentials were most affected by the lockdown. Even though levels of stress and depression were found to be moderate, severe anxiety issues that could be attributed to the current situation were very much evident. Seeing in our clinic, like we see the people who had actually recovered quite a lot in the past times, even they relapsed because of the fear of losing on to the close family members or not getting the employment or getting poor day by day as the pandemic was approaching or the pandemic was persisting. So we need to understand how COVID-19 affects depression in people. So isolation and loneliness, which fuels depression. Human beings are social creatures. Being cut off from the love, support, and close contact of family and friends can trigger depression or make existing symptoms worse. As we know, there were many people who were stuck up abroad or in different cities because the flights were cancelled. There was no way that they could come back. So people had to spend good couple of months, maybe 6 months, maybe 4 months at times, depending on the country of residing they were, that they were absolutely lonely. The only way to contact with the family was through the phone. So the months of social distancing and sheltering at home can leave you feeling isolated and lonely, having to face your problem alone because there was no support system. And as I suggested earlier, the people who were in the close contact with the family or who were living inside under the same roof with their family members, they had less impact of pandemic as far as the mental health goes as compared to the people who were not with the families. A troubled relationship, as we know, there are a lot of things which are going on. There were a lot of news about the domestic violence with the ladies or with the man. So we have been reading a lot about it because the husband and wives, the couples, they had to stay at home together for many months without getting any break from anything, from the daily chores, daily chores and everything. So there was increasing incidences of losing patience, increasing incidences of getting violent, aggressive, irritable. So there were more cases, and there were more cases of the divorces being filed in the court during the pandemic because people could not take the pressure of in the unsupported living at home and not being able to go out, meet with their friends, not having parties. The people who were party animals, they could not meet with their friends. So they were really taken aback and they were absolutely shattered and depressed because of this. So because most of the social distancing and sheltering at home can leave you feeling isolated and lonely, having to face your problems alone. There were no ways that people could go out and meet the counselors and all that. Even all the therapies which we were doing at that time, they were all online. So people don't find it that useful, though it does support people at the time of crisis, but it works as a crisis intervention rather than as the solution. Because people generally are dependent onto their therapist or their psychiatrist or mental health professionals, so they need to be more and more closer to them. They need that there is somebody who can take care of them at the time of crisis. So while once, as I suggested, that there were troubled relationships at home because of pandemic. So after the relationships getting troubled or getting disturbed, it became even more troublesome for people to stand alone the loneliness. While these strong and supportive relationships are crucial, supportive and strong relationships are crucial for your mental well-being, being forced to spend months quarantined in a troubled, unhappy, or abusive relationships can be even more damaging to your mood than being alone. As we know that if one of the family members gets COVID positive, and there are people who are not allowed to visit the patient as everybody was in isolation, so there were a lot of worries and a lot of insecurities with the people left back home, because for caring for their loved ones who were there hospitalized, and people were on ventilators, and we did not know, the family did not know whether the person will come back alive or will survive or not. So there was a lot of issues which were going on in people's mind. And at the same time, the anxiety can lead to depression. As people got more and more anxious, anxiety ultimately, when your coping mechanisms gives up, it can ultimately lead to depression, where you feel sad, you stop enjoying the previously pleasurable activities, your sleep and appetite goes for a toss, you can't really take care of yourself. So all the fear and uncertainty surrounding COVID-19 means it is natural to worry. When you worry, when your worries really spiral out of control, when you can't take it anymore, they can cause panic and anxiety, in which you feel that you yourself has an existential crisis at that time, as if, because we are not sure about our future, we don't know what tomorrow will bring. People were really glued to the TV, and people were really into the news, which was making more and more negative. It had more negative impact on their minds, because we could see the rising cases every day. We could see a lot of deaths going on around the world, and we didn't know what is going to happen, for how long this pandemic is going to last. So that really caused a lot of worries in people's mind. So experiencing a major change in your life, such as death of a loved one, or the loss of a job, or being diagnosed with a serious illness like COVID, which looked like as if it is the most serious illness in the world right now, or financial or relationship difficulties because of the job insecurities, or the lot of marital discord going on in the family. So it actually brought overwhelming level of stress in people's mind. And as a result of this pandemic, you may be expressing several of these major stressors at once, making you more vulnerable to depression, and even having suicidal thoughts, or the death wish that the life is not worth living. I have seen in my practice, there are a lot of people who got suicidal. They started planning the suicide. They actually attempted it, and few of them actually culminated into the suicide. So what actually happened during when people were back home, they tried to cope with the stress of the pandemic, but many of us, they turned to the unhealthy ways of coping. The boredom, the loneliness, and the stress of being in lockdown, struggling financially, or having to juggle a job at home and school. Your kids can prompt unhealthy ways of coping. So this is very important with people, because they were asked to have online classes all the time. So people actually got addicted to the internet gaming disorder also, because they had all the gadgets in their hands all the time. So there was no watch over the parents, the parents could not watch over the kids, as parents were equally busy into their own life stressors and making the ends meet. So the lot of children I am seeing who got really got glued to the gadgets, and they got addicted to the internet gaming disorder. So this is an unhealthy way of coping for the people, and the parents did not say anything to them, because they knew that the child is suffering. He can't meet his friends, he can't go out, there is no outdoor activity, there are no games, there are no sports, there is no gymming. So as far as the adult goes, the people started drinking too much, abusing drugs, or overeating junk food, in an attempt to self-medicate your mood to deal with the stress. This was very, very common, which we see. While these methods may provide a brief respite, one might feel that taking excessive booze, that day is gone, and one feels that one is fine because one is knocked off and the mind stops worrying for a couple of hours. But ultimately, it leads to lot of physical issues, health issues, dealing with the liver, the gastric issues, and actually, alcohol is a depressant, so it makes you more and more depressed. It cuts down onto your coping mechanisms, so it makes you more lonely and more depressed at the same time. So uh, in the long term, they will make your depression symptoms much worse. Instead, you can use the, then I can suggest you some methods by which people can cope up with the pandemics. As we know that the pandemic is still not far from over, the people are still suffering, they are still insecure as the number of cases are rising again. So there are multiple healthy strategies to boost the mood and take care of your depression at times. Of course, along with the help from the psychologist or a psychiatrist and the medication, there are many things which you can do on your own. So this is like the because the social and economic losses, the worries about the job and money and health, and the profound feeling of loss that many of us are experiencing at the moment can also trigger depression at the same time, which is a continuous process till the time we really get rid of this menace called corona pandemic. So there are many people who started coping up with repeated hand washing. As you know, that the COVID pandemic, initially we were asked, and even today it is true, that we should be washing our hands regularly, we should be keeping ourselves clean, trying to take bath once you come back from the work, maintain a social distancing and everything. So there were many people who actually started doing compulsive hand washing or compulsive bathing to in an attempt to relieve their stress or the distress associated with obsessive and irrational fear of contamination. Compulsive hand washing is often a debilitating psychodermatological condition, which is called obsessive compulsive disorder, which interferes with the patient's activities of daily living and quality of life and puts his morale down because his confidence goes down despite knowing that he should not be washing his hands so obsessively, so compulsively all the time. He would still keep on doing that for getting rid of that fear of corona, just to keep him safe. So what we can do, what is important, what should be done? So we should try to change our focus to deal with the depression rather than getting more and more into it and getting more worries about it, and rather listening to the people who are equally unequipped to deal with these stressors. Rather than taking the advices from these people, one should try to go to a professional. But before you reach to a professional, what else can you do to deal with this distress which is associated with this absolutely changed lifestyle which we have these days? So one is distract yourself. Now, once I say that distract yourself, now distracting can be like I have been suggesting a lot of people in my clinic to start reading some good books. The people who were glued to their jobs and they were into 9 to 9 jobs, 6 days a week, 5 days a week, they never knew that there are a lot of good books to read in the market, which can actually pamper you, which can tell you the ways to deal with the stress. There are multiple books which tells you how to improve onto your personality, your confidence, how to deal with the relationships, how to deal with the disturbance in the marriage, etc., etc. There is a long list. So I suggested people to start reading books because this is the time that they had some time on their hands, and this will actually help them in enriching their own psyche, which once they start reading these books, they came to know about their new techniques of dealing with the stress, and that really helped a lot of people who have understood how important it is to read, how important it is to invest in yourself by reading. Then I've asked people to find simple joys of life. Now, simple joys of life, the people who never had time to spend with the family, even to have food at the same time on the same table, I've asked them to start playing board games with their kids, with their spouse, and even to start chatting with their neighbors whom they hardly knew what his neighbor is, what his name is, what he does. So I've asked them to start interacting with the local people where they're staying, because earlier they were just focusing on their work and their career or their children's career. So this is the time I have asked them, they should know that this is the time that they should actually be going beyond the usual rut of life by doing all these things, you know. Then one more, which is very, very important thing, which I've been telling people from the day one, that they should limit the consumption of news, because the media initially was just highlighting how bad this disease is, and there were people who were not able to actually cope up with this fear, so they were getting more and more worried about it. They were getting more depressed, they were getting more lonely, they were losing onto their confidence. So these were the people who stopped meeting, even to their guards, even to their servants. They asked their servants to come after 6 months. So which made their lives even more difficult, because if the household help is not there, they are doing all the chores themselves, which is good in a way that they're learning something new, but at the same time it was putting an extra burden onto them, and at the same time giving salaries to somebody, their staff, without taking work from them, also caused a stress into their minds, financially also and psychologically also. And then I've asked people, if even if there is a holiday for you, like you few people, they keep on sleeping throughout on Sundays when they're working 6 days a week. For during pandemic, during isolation, there were 7 Sundays in a week. So I wanted people to start doing something, at least exercise inside the house. Even if you are not able to go out, do some exercises, floor exercises, some stretching. Try to make a little jog, stationary jogging, getting skipping or anything, or buying dumbbells, bringing them at home. Do some exercises so that there is a routine which is maintained, because our body maintains on a particular routine which is called circadian rhythm. So this rhythm works with the sunrise and sunset. So if we are not able to maintain that routine, all our hormones and brain chemicals, they actually get disturbed, and which actually prompts her to feel more sad and more depressed, because there are no happiness chemicals or hormones being secreted if we are not exercising, if we are not maintaining a routine. And then, of course, last but not the least, I always believe that express gratitude, that despite so many people suffering, despite so many people dying all over the world, if we are still safe, if we are still able to work, if there's not been a permanent or temporary damage to our system because of the corona pandemic, there were people who were working for us, there were doctors, the frontline workers. So we should express the gratitude to the Almighty for the blessings which we have from the God. So that way, the depression can be managed and treated with the right care very, very effectively. And I always tell people that try to remain optimistic, that we will eventually get to the other side of pandemic. This is a passing phase which may look little dangerous, which may look little longer, but ultimately we will cross it. And with the vaccine which we have in the market, and there are so many million people are being vaccinated all over the world every day, we starting to see light at the end of the tunnel, and there are a lot of new therapeutics, there are a lot of new medication and new research is going on all over the world. The maximum number of scientists are working towards the corona only, how to treat people even if there is a mild infection. So now we know quite a lot about corona, but still far from over. We know that. So we still need to maintain all these things to keep ourselves calm, to keep ourselves sane, which is very, very important for the tomorrow. We are learning, we are connecting and evolving as we are progressing through the pandemic. It will take time before we can actually start to reclaim the pre-pandemic normalcy, but ultimately we will actually get there eventually. That's all I wanted to say. Thank you very much.